Good afternoon, everyone. I'm Lynn Videcka, Dean of the School of Social Work at the University of Michigan. Thanks so much for joining us for this Centennial lecture series. This is the fourth of our Centennial lectures. It's been a wonderful first semester celebrating our Centennial year. And I want to thank our alumni, donors, students, staff, faculty, and friends for making these events such a success. We're looking forward to a full calendar of events and activities to continue our celebration this fall. Please keep checking our Centennial website. Emma will put the link in chat for regular updates. And I want to invite everyone in the audience to participate in helping us create a narrative history and oral history of your experiences at the school and your experiences in your social work career. So check the website for the oral history project. Today, I'm really delighted to welcome our keynote speaker, Michigan social work alumna, Sharon Parrott. Sharon is the president of the Center on Budget and Policy Priorities, a major progressive think tank in Washington, D.C. that has shaped so many important social policies, including the Earned Income Tax Credit. Sharon has nearly 3 decades of experience at the center and in government. She began at the Office of Management and Budget and then moved on to serve at the Center for Budget and Policy Priorities. Sharon's expertise spans a broad range of issues, including policies to reduce poverty and expand opportunity, the intersection of the federal budget and low-income programs, and the use of data and analysis to inform policy debates. It's so great to see a social work alumna leading the charge in terms of policy analysis and policy development. Sharon's full bio is on the screen, but I want to highlight a couple of things. Sharon served as the Center's Senior Vice President for Federal Policy and Program Development before she took over as president, only the second president in the history of the Center in 2021. Sharon Parrott played a key role in the Center's work on the federal budget, the impact of federal budget decisions on low-income populations, low-income tax policy, and policies that ensure solutions to climate change does not adversely impact the economic well-being of the lowest income households. It's really an honor for the school to showcase an alumna who has been such a leader, who has really changed structure. We talk about changing structure, societal structures that oppress and impede people. Sharon's doing the work of changing those structures for the better of our society and the better of the people who are most oppressed within our society. And for that, we're very grateful. I'm also going to introduce our 2 panelists who will respond and have a conversation with Sharon, and will also use some of your questions that you've submitted from the audience for discussion later in the session. Our 2 panelists discussants today are Luke Schaefer and Laura Ortega Fuentes. Luke Schaefer is a professor of social work and the inaugural director of Poverty Solutions, a university-wide interdisciplinary presidential initiative that partners with communities and policymakers to find new ways to prevent and alleviate poverty. Luke is also appointed the Herman and Amelie Cohn Professor of Social Justice and Social Policy, and he is the Associate Dean for Research and Public and Policy Engagement at the Gerald R. Ford School of Public Policy at the University of Michigan. There's almost nothing Luke can't do, and he does it all. Luke is an internationally respected public scholar of social welfare policy. His research is supported by federal agencies and published in influential journals. He's a Carnegie Fellow, and his book with Catherine Eden, $2 a Day, Living on Almost Nothing in America, has won many awards. And just for fun, and just yesterday, he had earned a special notable achievement. And on the popular TV show Jeopardy, just last night, a question referred to Luke's book, $2 a Day. And there you go. That's a screenshot from the Jeopardy show. So I hope a few of you in the audience were watching last night. So we're pleased to have Luke as one of our discussants. Laura Ortega Fuentes is a Michigan social work alumna from 2008. And Laura has been practicing macro social work for a dozen years. She is currently the Workforce and Homeless System Alignment Program Manager at the organization Detroit at Work. Prior to this role, Laura served as University of Michigan Poverty Solutions Homelessness Policy Fellow, a unique partnership between Poverty Solutions and the city of Detroit meant to increase capacity and infuse the city with the university's action-oriented research. In all of her work, Laura strives to enact effective systems change by incorporating national best practices, local data and analysis, and the voices of all necessary partners and including those with lived experience. And now, on to our lecture. Sharon, I turn it over to you.
Thank you. And thank you so much for that kind introduction. First, I'd just like to say thank you to Dean Videka, to Emma Krasaniak, and to everyone who's helping to plan the Centennial events for inviting me here today to be with you and for all of the work to make the event possible. I'd also like to thank the discussants, Laura Ortega Fuentes and Luke Schaefer. Thank you for being a part of this. Second, I'd just like to congratulate everyone associated with the University of Michigan School of Social Work, to all the current and past faculty, the staff and students, current and past, and your supporters inside and outside the university for the role you all have played in shaping the school. In shaping the school over time and helping it to reach its centennial as a strong and impactful school at a wonderful university. I will say that my time spent at the School of Social Work more years ago than I care to recount. I'm very grateful there was no picture comparison here. Really did shape how I looked at the world and how I attacked problems. And I know it continues to do that for students year in and year out. So with that, let me turn to the presentation. Today, my presentation will be divided into 4 parts. First, I'll talk about the pandemic and the economic crisis that resulted, and I'll really focus on who was most affected and how the twin crises both highlighted and exacerbated longstanding racial, economic, and ethnic disparities. Then I'm actually going to go backwards a little bit and talk about the state of our economic and health security programs. By the way, that's the term I tend to use for the safety net. So I'm going to talk about the status of those programs before the pandemic, and how the gaps in those programs as we came into the pandemic really meant that we had to do a lot of emergency measures in order to prevent even greater suffering and hardship. The third thing I'll do is then talk about the relief measures the country enacted and how both the good, the bad, and the delayed ways that we responded to the crisis. And then finally, I'm going to talk about the prospects for longer term policy advances and reflect on what I've come to think of as the long arc of policymaking. Now, any of these 4 topics, I believe, could be a presentation on their own, and probably a dissertation or 2 in there. So my goal is to give you broad highlights and not every detail. I have some slides, so I'm going to share them periodically, and also try to leave them behind for some of the time, at least at the end. One last thing I'll just say is my goal here is not to be partisan. in these remarks, but I will speak candidly about where I see differences between political parties and their approach to helping struggling families. So I guess that's a little bit of a warning. And so with that, let me share my screen. This will be a good test here. Everybody good? Everyone can see them? Great. So with that, let me begin. Okay, there we go. As all of you are aware, because you all lived through it, in March of 2020, the awareness of COVID-19 reached the United States, and with so much unknown about the disease and how to mitigate and treat it, states and businesses took pretty swift action at the beginning, right, to shut down a large amount of non-essential business activity. The loss of jobs was stunning for its depth and its speed, with some 22 million jobs lost between February and April of 2020. So that's that big dip in that big loss of jobs. Now, to be sure, as this chart shows, many jobs did come back relatively quickly, and many didn't. So in December of 2020, the economy was still down about 10 million jobs, which was actually a larger jobs gap in percentage terms than at any time during the Great Recession. So in December of 2020, and even you can see that we haven't gained back so many since then, right? The jobs gap was very large, larger than at the worst part of the Great Recession. So I'm actually gonna look particularly at this February to December period, sort of before we get to vaccine and things start to look up a bit, and talk about where those job losses were concentrated. And you'll see a theme throughout these remarks is that this has been a terrible time a terrible period for the United States, and the pain was not evenly shared, not even close. So that's sort of like the headline here. Okay, so when we look at these big job losses, an important question is, where were those job losses concentrated? And what you see is that they were heavily concentrated among industries that pay low wages. So just a quick methodological note, we took industries, we divided them, we looked at their average wages, we divided them into 3 roughly equal groups, and we looked at low wage jobs, low wage industries, medium wage industries, and high wage industries. It's important to know that in any given industry that we might have defined as a low wage industry, that doesn't mean that everybody in that industry earns low wages, right? There's some people that earn high wages, but on average, their wages are low. And what you see, right, is pretty clear that job losses over the February to December period, and this has remained the case through April, that the job losses are heavily concentrated. They're much larger in those low wage industries. Now, sticking with that February to December period, we also see that people of color, and in particular women of color, saw far larger job losses than white men and white women. At the same time that low-paid workers, disproportionately people of color, were losing their jobs, those who kept their jobs, those low-wage workers, low-paid workers that kept their jobs, were often in so-called essential jobs, and so they continued to work in person. And they were at heightened risk because of their jobs of contracting COVID-19. And in addition, many lived in communities that had crowded housing, and that also included a lot of other workers that were in essential jobs and remained in person. And so there is this kind of sad irony that this group of low-paid workers, disproportionately people of color, were both at higher risk of losing their job and at higher risk of contracting COVID-19. And we saw higher mortality, certainly among those groups as well. Now, it isn't the case that the only people who suffered economically were those were in households where somebody lost a job. Many others were impacted as well. So it's not like the only people that were impacted were people in those households with job losses. Some people kept their jobs but saw their hours and wages cut. Some people were out of work when the crisis hit. They had very bad timing. They were out of work before the crisis hit and had every reason to expect that they would be able to get a job relatively quickly, at least those that were able to work, right? But now this crisis hits, and what would have been a short stint of unemployment became a very long stint of unemployment. Other households faced difficulties too. Many faced increased costs. Children were suddenly home quite a bit. I suspect some of you in the audience have some experience with that. So children were home quite a bit. They were missing out of school meals at home. So their grocery bills were going up, the utility bills were going up, and having access to the internet became even more essential. And so that leads me to my next point, which is most data, but not all, most data suggests that the number of people in households facing various kinds of material hardship, such as not being able to afford enough food, went up during the crisis. Though we don't have perfect comparison data to the pre-pandemic, and all the data sources don't point to precisely the same conclusions. But what's quite clear, I think, is that hardship over this period is high, and it would have been much, much higher if policymakers had not enacted a series of relief measures that provided really important help to people that were struggling. And what's also extremely clear is that the people facing difficulty affording food or paying rent were disproportionately Black and Latino, with too little data collected on Indigenous people, but strong suggestions that Indigenous people and immigrants also faced high burden from the economic fallout. These are the same groups that faced higher infection and death rates as well. Now, the picture of hardship and lost jobs stands, so this, whoa, that's not what I wanted. So this chart is kind of an overarching hardship chart that looks at difficulty paying expenses. This one is specific to food insufficiency. Now, this picture of hardship and job loss stands in quite stark contrast to how many of the wealthiest households fared over the period of the pandemic. First, remember that high-wage industries, so where most high-wage workers work, right, lost fewer jobs to begin with, and those jobs came back more quickly than in those lower-paid industries. But the wealthiest households garner a lot of their income from capital, not from labor. And after an initial dip, stock prices rose basically throughout the entire pandemic. It's this dichotomy between what happened among households that came into the pandemic with lower incomes to start and little savings, and what happened to the jobs trajectories of high-income workers and their stock portfolios that have led observers to call this a K-shaped crisis and recovery, meaning that some people were doing just fine and some people were having real difficulties. And we should be clear and explicit that this pattern of hardship and stock gains have strong racial equity implications, right? We have stock portfolios predominantly of white households growing, and we have high job losses and more hardship among a group that is disproportionately people of color. Now, it became somewhat fashionable over the last year. I will say I bristled every time I saw it in a press report for people to say as the crisis unfolded that the crisis had uncovered sharp racial and economic disparities in the country and weaknesses in our existing set of economic and health security programs. Perhaps. But for struggling households, the crisis didn't uncover very much that they didn't already know. The realities of disparities in the United States and the weaknesses in our system of supports were there. They were their lived experience, and frankly, they were there for anyone to see. If they were uncovered, they were hiding in plain sight. So with that, let me go to part two. I want to turn to the status of our economic and health security programs prior to the pandemic. Now, you may have heard the expression, you go to war with the army that you have, not the one that you wish you had. Well, we entered this crisis with the programs and supports that we had, not the ones that we wish we had. And then we worked hard to fill gaps and bolster supports as the crisis unfolded. So we were essentially building or at least renovating a plane as we were flying it. The first thing to say, though, is that I'm not going to actually walk you through only the ways that our system fails people. In many ways, our economic and health security programs were stronger in 2019 than in prior decades. And at the same time, there were important gaps that meant that policymakers really had to make substantial changes to mitigate hardship. So with that, this chart has the best data we have for measuring poverty that corrects for underreporting and uses one version of the supplemental poverty measure. And I know I'm speaking to an academic audience, so for the wonky poverty measurement nerds out there, this is using the anchored SPM. And what you see from this chart is that poverty was lower in 2017 than in any of the years going back to with data going back to 1967. And the reason that it was let down was largely because of economic security programs becoming stronger. Things like SNAP, what we used to call the food stamp program, refundable tax credits, Social Security, and other government programs have become stronger over this period. And you can see that because the top line, that sort of blackish gray line, is showing you what poverty would be if we didn't count any government benefit programs at all, just people's own private income. And the blue line is saying what the poverty rate is when you count all of those benefits. And you see that the top line's pretty flat. It's not a lot of progress. And the blue line has gone down, not as much as we would hope, but certainly has gone down. So that's the good news. The bad news is that poverty remains high and that racial and ethnic disparities are breathtaking. These are showing you the same concept as the prior slide, but showing you by race and ethnicity. So I will say I have a set of charts, but I'm not going to show them to you today, that do this for children, and it's the same basic story. Real progress overall, but gaping disparities by race and ethnicity, and overall high levels of poverty. Economic security programs absolutely reduce the disparities by race and ethnicity, but they don't come close to overcoming them. Now, different parts of our system of supports have changed in various ways over the decades. Social Security, refundable tax credits, the SNAP program have grown stronger. Unemployment insurance and basic cash assistance for families with children with very low incomes and for childless adults have become weaker. So let's just look for a minute at unemployment insurance, because this is a program that's going to play a big role in our response to the current crisis. Just prior to the pandemic, fewer than 30% of unemployed workers qualified for any unemployment benefits at all. This figure typically rises some during recession, so if we had done nothing, that rate would have gone up some for sure. But still, over time, unemployment benefits cover a smaller and smaller share of people who have lost their jobs. And for those who do qualify, if they were in a low-paid job, their benefits are quite low, and they often qualify for fewer weeks than they need of benefits. What this means is that in the United States, when someone loses their job, they are more likely than not to get no help at all. If they do get benefits, benefits are low and they often don't last long enough. Now, who is the least likely to get jobless benefits when they lose their job? Precisely the groups that would be hit hard in this crisis: low-paid workers, women, and workers of color. All of this means that even a temporary stint of unemployment is often an immediate financial crisis for a family. That's important because as we head into this crisis, millions of people are going to start losing their jobs, and the unemployment insurance system that is sitting there waiting is completely unequipped to serve all the people that are in need and to serve them quickly and well. And so we'll talk in a little bit about what the steps that the nation took to shore this up and what that means for the long term. So another part of the safety net that's become weaker is the basic cash assistance program for very low income families with children. This is something that some of Luke's research really touches on. That program, known as TANA, for Temporary Assistance for Needy Families, serves only about 22 out of every 100 families with incomes below the poverty line. Back in 1996, before the welfare law was passed, it served about 68 out of every 100 poor families with children. Now, health is an area where we have made improvements. There's no question about that, but we also still have a long way to go. We entered the pandemic with 29 million people without health insurance. So that's not an ideal way to start out in a pandemic. Now, that number is down significantly because of the strides we made in the Affordable Care Act, but it's still a lot of people without coverage. And again, who's most likely to be uninsured? Low-income adults, disproportionately people of color. We've made a lot of strides in getting coverage to children through Medicaid and CHIP, and seniors have access to Medicare. It is really the adult population, particularly in states that have not adopted the Medicaid expansion, but even beyond that. Okay, so those are some of the downers. Let's talk about what's gotten stronger. So SNAP, which is what we used to call food stamps, is a program that's grown stronger in recent years. It reaches a very large share of eligible households eligible for assistance, and this is showing you how large the reach is of the SNAP program to families with kids. It reaches a particularly large share of poor households with kids. Its reach has improved in the last couple of decades, but benefits do remain low, and research has documented that they are lower than what families need to afford a healthy diet. And another part of our system of supports that's gotten much stronger in recent years are refundable tax credits, things like the EITC, or Earned Income Tax Credit, and the Child Tax Credit. A refundable tax credit means you get it because you file a tax return and you get money back even if you don't owe federal taxes. In 2018, before the most recent important but temporary expansions in these credits was enacted, the Earned Income Tax Credit and the Child Tax Credit together lifted 10.6 million people out of poverty and made another 17.5 million people less poor. Didn't get them all the way to the poverty line, but it got them closer to the poverty line. The credits aren't perfect. The Child Tax Credit gives no help or only partial help to low and no income households because there's essentially an earnings test to get the full credit. And the EITC for workers without children is extremely small. I'm telling you those details because we're going to come back to them later as a potential area of real policy advances. A few other quick facts. Our housing programs reach only a small share of eligible households because funding is too low. There's no national program of paid family and medical leave. That means as the crisis hits, people don't have a paid family or medical leave program to rely on. And our childcare system is underfunded, which means childcare providers often are on a shoestring budget, and many children who need help paying for childcare don't get that help. This meant that as more people face difficulty, this has meant that as more people face difficulty affording housing or needed to take time off from work because of the pandemic, we didn't have existing structures that would just automatically expand to help. Okay, so what did we do? This was the safety net we came into the crisis with. What did we do to respond? So the first thing to say is that programs like SNAP would respond automatically, right? Because it's an entitlement program, which means everybody who applies and is eligible gets help. There's not an artificial cap on the amount of money. And it already reaches a large number of people, but as more people need help, it would expand automatically. But tax credits are terrific, but they really only help once a year when you get, you file your taxes and you get quite a large amount of money, but more people needing help wasn't going to trigger more help through the tax credits in real time. And the unemployment system just had these very large gaps in it. And even despite progress under the ACA, we had 29 million people without health care. So the political landscape, that's the safety net we had. The political landscape was that Donald Trump was president and control of Congress was split. Historically, and this would prove true during the crisis as well, Democrats were far more focused than Republicans about getting direct aid to struggling families. Democrats only held the House, but there was a political imperative for both Democrats and Republicans to address what was clearly going to be a very difficult time in our nation's history. So Democrats actually ended up having more leverage than you might have thought in that political landscape because of the imperative to get something across the finish line that Republicans felt as well. So what happened? Congress passed and President Trump signed into law 3 relief bills. And then early in President Biden's term, with Democratic control now of the House, the Senate, and the White House, Congress passed a 4th relief bill called the American Rescue Plan. Now, I want to say that the timing of relief really matters. If you need help today because you've lost your job today, a great bill that passes 7 months from now doesn't really help you today, right? So I want you to look at the dates. The first two bills were enacted quickly, but then no further congressional action is taken until the very end of the year. Between when the CARES Act passed at the end of March of 2020 and the December package that passed in the waning days of the calendar year, parts of the unemployment benefit expansions lapse over the summer. And it's clear that hardship is high and there are important gaps in relief, with large numbers of people behind on rent, high COVID transmission rates, and homeless shelters as just two examples of some of the problems we were seeing over the summer and into the fall, but not responding to from a policy perspective. It's also clear during this time that we aren't doing enough COVID testing and tracing, and many states and localities at this point in the crisis are facing real problems as their revenues fall. Some are starting to take action to make cuts in their states and localities. Now, eventually in late December, after the election and before the riot on Capitol Hill with strong racist underpinnings, eventually in late December, Congress does act, and that is good. That is an important set of relief measures that get done, but the delay really matters. Expanded jobless benefits are restored, SNAP benefits are increased further, and a substantial infusion of housing aid is made that allows us to begin to do more on the housing side. But that doesn't erase the damage that's done from months and months and months of delay. Now, the next two slides are an attempt to provide a very high-level overview of the key kinds of relief measures put in place over the course of the 4 relief bills. So I'm going to try to do this quickly, and I'm happy to take questions in the Q&A. But one big thing, one big thing that we did was direct aid through stimulus payments. And the first time that such payments are made to households, so the CARES Act includes direct stimulus payments, and this would represent the first time that we use a stimulus payment or a tax credit to provide help to households, including households that don't usually file a tax return and that have no income. Though it's not going to be perfect for them, and many are going to miss out on this help because they don't know or understand how to file for the help. These stimulus payments are designed to get money to households during a hard time. They're not particularly targeted. They don't go to everybody. They don't go to the highest income families, but they do go fairly high up into the income spectrum. But remember, they're looking at backwards at income. So they're looking at last year's income and then providing these payments. And so some people who are getting them had relatively high incomes the year before, but may now be out of work. It's a quick way to get money out. It's not a targeted way to get money out. We provided stimulus payments in 3 tranches: the CARES Act, the December package, and then the American Rescue Plan, with that last rescue plan having the largest payments. The second thing we did was large-scale expansions in unemployment benefits. I told you we were going to circle back to unemployment. So remember, going into this crisis, it's a really weak system, and a broad swath of job losers are at risk of getting no help at all. So Congress expanded eligibility substantially, so groups that traditionally had been locked out of jobless benefits are now eligible. And they made the benefit much larger, adding $600 a week to the basic benefit, which is a very large expansion because usually benefits were $300 to $400 a month. So it's a very large increase. And the benefits were made available for far more weeks. But the basics of the program itself are weak. And states are struggling throughout the whole first half of the pandemic to just deal with an avalanche of applications. The expansions ultimately help millions of people, and there are still millions of people getting jobless benefits that would be entirely ineligible except for these expansions. But it wasn't simple, it wasn't pretty, and it wasn't without a lot of delays for a large number of people. We were essentially piecing together a better system with duct tape and string, even in the midst of a crisis. So as I noted before, there were also important lapses. So that $600 benefit increase expired in July. Fortunately, the eligibility expansions didn't, but the benefit increase expired. And And they wouldn't be restarted until that December package, and then they would be restarted at $300 a week. All right, third, we expanded nutrition assistance in a variety of ways. Remember that I said that SNAP does a very good job of reaching people, right? It reaches a high share of people eligible for the program and a very high share of poor households with kids. Benefits are too low. So that meant that SNAP was relatively easy to build on, right? Because lots of people are getting the benefit. And if we just increase the benefit, they will keep getting it and they will now get more help. So Congress boosted benefits in SNAP, and that flowed quite rapidly, actually, and pretty seamlessly to households. They didn't have to apply for anything. They didn't have to raise their hand and say they needed help. It was targeted, but it came automatically to people already getting benefits in the program. And I will just say that Michigan was extremely quick to implement this and a number of other nutrition provisions. So big shout out. I think Luke was part of that. Many people in Michigan were part of that. We also recognize that children were missing out on school meals when schools shut down to in-person learning. And so another thing that was enacted was benefits that would go to families that they could use to buy more groceries because now their kids were home and they were missing out on school meals. This also built on the basic SNAP architecture in a lot of ways, although school meal programs go to people who are ineligible for SNAP. There are immigrants who aren't eligible for SNAP because of restrictions on SNAP benefits for certain groups of immigrants, but children are eligible for free school meals based on their income, regardless of immigration status. And so while so it wasn't seamless and super easy, but a lot of progress was made. What's next? School meals. All right. So the December package and the American Rescue Plan include substantial amounts, well over $50 billion in housing assistance, including rental assistance for people with large past due balances or who are unable to pay their current rent. And there was also funding for homelessness services and some other kinds of housing interventions. The rollout of this has unfortunately been slower than I think most of us would like. And the reason is that unlike SNAP, this is not building on top of a program that already does a good job of reaching people, not because the housing programs are ineffective, but because they're so underfunded that they aren't already reaching a large group of people. And so that means that states and localities and other grantees that are getting quite a large infusion of dollars have to do more to build out a program. It doesn't mean that they're starting entirely from scratch. These are entities that run homeless programs and run housing programs of various kinds, but this is a massive infusion of money relative to the kinds of resources they generally get. And there isn't a standing program like SNAP that you're just totally just adding to. The American Rescue Plan includes two sets of policies, expansions in the EITC and the child tax credit, that's the first, and policies to expand health coverage that both respond to immediate needs, but also are clearly and interestingly quite explicitly on the part of policymakers, down payments on permanent policies the administration and Democrats in Congress want to enact. The expansion of the child tax credit alone would reduce child poverty by more than 40%. It's a historic game changer, but these are temporary measures, so permanent change will depend on further congressional action. Okay, relief packages, including both the American Rescue Plan, the most recent plan, as well as earlier plans as well, also directed aid to state and local governments, as well as to usually to state and local governments, but for particular purposes like education and childcare. So I'm going to stop sharing and go to my last. Oh, good, that worked. And go to my part 4 of this presentation, which is where do we go from here? Hopefully, the health crisis is subsiding, at least here in the U.S., with lots of unknowns still ahead of us, particularly about remaining vaccine hesitancy, the question of when will all children be able to get vaccinated, and whether variants run the risk of creating new waves of infection. But for now, the news on the health side is better than just a couple of months ago, and I know that that's particularly true in Michigan, which had a very rough couple of months in this latest wave. And the economy is starting to recover as well, with an uptick in hiring and economic activity, but lots of uncertainty about the pace of recovery. There are some concerns about inflation and friction in the labor market, and some real trauma in terms of businesses that probably won't reopen, and permanent changes in demand for certain things. Like what happens to businesses that catered to in-office work if in-office work becomes far less prevalent? Hopefully, hiring will gain momentum and we will have more months of positive news. I personally expect a fair amount of bumpiness as things resume and some permanent changes set in, as well as people's perceptions of work and the work they want to do sort of change and adjust to new realities. But even if the economic news grows stronger and more upbeat each month for the rest of the year, even if that's sort of the best case scenario, a return to the pre-pandemic status quo, in my view, should be considered unacceptable. So a return to strong economic growth, but growth that gives most of its benefits to people at the top and produces vast disparities across lines of race and ethnicity, and a return to a set of economic and health security programs that mean millions struggle to afford the basics, that children's life chances are shortchanged every day because of their circumstances, their poverty, their race and ethnicity, and that millions have no access to affordable health coverage. That was the status quo going into the recession. Strong economic growth, very unequal, and a very and a safety net that had grown stronger over time and yet was leaving millions behind. And so the big question facing policymakers now and over the coming months is whether we're going to take bold action to really change some of the fundamental ways the economy works and opportunity and well-being are distributed. Now, the Biden administration has put forward a broad and ambitious recovery agenda that includes both substantial investments in things like infrastructure and broadband and climate, as well as significant changes to our economic and health security programs. The Biden plan isn't perfect. I could do another talk with you about the things that need to change about the Biden plan. And indeed, the organization I lead is working hard to make sure that some important policies aren't left out. But big picture, the administration's agenda is seeking to change important pieces of our basic social compact. For example, extending critical expansion, the plan would extend critical expansions in the EITC and the child tax credit. As I said before, the child tax credit alone would reduce child poverty by more than 40%, with reductions larger for children of color than white children. The temporary expansion of the child tax credit and the rescue plan is a game changer. It says that all children, except the very wealthiest, will get a child tax credit that can help their parents meet their needs. And it reverses a longstanding upside down element to the child tax credit, which is that it gave no help or less help to low-income families that needed it the most as compared to middle and higher income families. Putting an income floor below children would be a first in the United States. It would bring us closer to how other wealthy countries support families with kids. That is a real possibility of extension this year, but but not by a long shot, a done deal. The plan that the Biden administration has put forward would also create the first national paid family and medical leave program. It would expand childcare assistance, eventually getting to a place where all young children that needed help paying for childcare would get it. It invests in education through both universal pre-K and free community college, as well as expanded Pell Grants and help with tuition at minority serving institutions like HBCUs and Hispanic serving institutions and tribal colleges and universities. And it would build on the Affordable Care Act by making the rescue plan expansions of marketplace coverage subsidies permanent. Now, the president has also called on Congress to reform the unemployment insurance system, though he didn't put forward a specific plan. And we and many others are pressing for that reform that is badly needed. A temporary job loss just should not spell financial crisis for a family, and we have the possibility of making real improvements there this year. We'll stay tuned. Another piece we at the Center on Budget are pressing hard on is a very particular Medicaid issue. And I want to highlight it here because I think it really demonstrates some important and painful realities in the United States about disparities and their racial underpinnings. As you may recall, the Affordable Care Act was supposed to make everybody below 138% of the poverty line eligible for Medicaid. Everyone with incomes above that would be eligible to purchase, if they didn't have employer coverage, could purchase coverage in the exchange and get subsidies to make the coverage more affordable. But lawsuits were filed seeking to overturn the ACA for a whole range of reasons, and eventually it reached the Supreme Court. And while the law was broadly upheld, giving us all a huge sigh of relief, the court ruled that states must have the choice to take the Medicaid expansion. That the ACA, what the court ruled was that the ACA, by saying to states, you have to expand Medicaid to this new population. And if you choose not to, you can choose not to, but you have to withdraw from the full Medicaid program. The court decided that was unduly coercive. Now, it was quite a ruling in the history of the law in this area. This does stand out in a particular way. But setting aside the legal issues, it meant that states could choose to expand Medicaid or choose to let people who were supposed to be covered by Medicaid go uninsured. Most states expanded, states like Michigan, others. After all, the federal government was picking up most of the costs of the expansion. And over time, states that expanded found that they saved money overall because of the reduction in uncompensated care. But a set of states, mostly in the South, refused to adopt the expansion. And in those states, more than 2 million people, 60% of whom are Black or Latino, have no access to coverage. They aren't eligible for Medicaid because their state didn't expand coverage, and their income is too low to be permitted to purchase coverage in the exchange with subsidies. They are literally stuck. The rescue plan enacted in March sweetened the pot for these states, adding new financial incentives that for states that newly adopted the expansion. And while that did start a conversation in some of these states, it's increasingly clear that in many, and sadly perhaps most of the recalcitrant states, they won't adopt the expansion regardless of the incentives provided. It is impossible for me not to see race as a factor here. At this point, states are refusing to adopt the expansion. They are effectively writing the federal government a check for the privilege of denying health coverage to people in their state. I've been doing policy work for a long time, and many policy disagreements have been dismaying to me. I will say that this one is about the hardest one. It's a particularly troubling one. This year may be our best chance for many years to come to fix this once and for all. And setting aside the details of how you would do it, at the end of the day, we need to make sure that everyone has coverage, even if you live in a state that for some reason strongly prefers that a group of low-income people, disproportionately people of color, lack coverage. So that's some of what we're focused on here at the center. I'm not Pollyannish, try to be optimistic, but not Pollyannish. I know that it's likely that some key policy advances aren't going to get to the finish line this year, but this year represents a historic opportunity to make significant headway across a range of areas that would really make a meaningful difference in the economic and health security of millions of people, including children, for whom greater economic security can mean better lifelong outcomes in education, in health, and more. And so that brings me, in my remaining few minutes, to the last set of points I'd like to make, which are some reflections on the arc of policymaking. So the first thing I would just like to say is that policymaking builds on both past successes and past failures. It's just one example. The Great Recession was a terrible economic downturn. And we enacted what at the time was considered a fairly robust relief package. But as it turned out, and as frankly many people predicted at the time, it was too small. It did a lot of good and it mitigated a lot of harm, but a larger, more robust package would have made the recession shorter, it would have made it shallower, and it would have mitigated tremendous human suffering. So Republicans spent the better part of a decade maligning the legislation as profligate, but ultimately the reality of what happened became common knowledge. It did a lot of good, it should have been bigger. And when we hit this crisis, which I will grant you had a different political landscape to it, there was broader recognition that we needed to go big, and that recognition was shared by both Democrats and Republicans. The second point I will make is that incremental policy change should not be a dirty word. It is how most policy change happens, and it sets the stage for large change over time. The child tax credit was first created as a $500 credit that was essentially only available to families that had a positive income tax liability, that earned enough that they owed federal taxes. So poor families were cut out of the credit entirely. But step by step, the credit was expanded. First, it went to $1,000, then it went to $2,000. And we kept broadening and broadening and broadening the set of low-income families that could get at least some help through the child tax credit. Over time, a set of policymakers began making bolder proposals to make the credit larger, more like $3,000 or $3,600 per child, and to make it fully available to poor and low-income families. That is a really big step, and it was made, but only for 1 year in the American Rescue Plan. And now the question is whether we will make those expansions permanent, and we are working every day to bring that to make that a reality. But I don't see how, given the basic political landscape and history of the country, we could have possibly been poised to make that bigger step today if we hadn't made a series of smaller steps over the last 2 decades. The third point I would make is it's really important to be ready. Large policy advances don't happen every year. Historically, they most often happen at the beginning of a new administration when one party controls the White House and both houses of Congress. And those moments are rare. This is only the third time in 40 years that Democrats have had unified control of the federal government. When they happen, you have to be ready for them, to have good ideas that hopefully have been tested and at least well vetted, ready to go. If you step back and think about the kinds of proposals the Biden administration has put forward, education, childcare, family leave, child tax credit, health coverage expansions, infrastructure, climate, how were they ready to do that? They were ready because these ideas have been worked on by policy groups, by academics, by members of Congress for years. And some have been implemented in states and localities. They had bases of support already. So really being ready is important. I will just say that when President Trump came to office, his party controlled similarly the White House and both houses of Congress. And the central thing that they campaigned and tried to do was repeal the Affordable Care Act, and they failed. And there's lots of reasons why that happened, but part of it is that they had been fighting against the ACA for years, but they didn't have a plan. It became obvious that they didn't have a plan. And ultimately, the public was not that interested in getting rid of something that gave 20 million people health coverage and replacing it with nothing. And members of Congress ultimately, by just a hair, weren't willing to do it either. Fourth, offense and defense are both important to policy change over time. Many people who do policy work will tell you that these times of offense are more fun. And I get that. I would say that probably too. But playing defense when that is what the moment calls for is every bit as important. Policymaking has cycles, and sometimes we're in a position to advance an agenda, and sometimes we have to stop bad things and retrenchment and cuts. And if we don't win those defensive battles, when we once again have the opportunity to make positive change, we'll first have to spend time and energy and political capital just rebuilding what we have lost. So it is true that offense can be more interesting, more fun maybe, or I don't know, sexier somehow than defense. But winning on defense is absolutely a part of ultimately winning on offense. And the last thing I'll just say, and I know I'm just a couple minutes over, is that the conversation about racial equity and economic justice has, in my view, really changed. Whatever the ultimate outcome of this year's policy debate is, I do think this year represents a change in how the center left of the political spectrum think about policy and racial equity, and certainly how they talk about it. 4 months into a new administration is no time to say that the nation, or even a chunk of it, is ready to grapple with the nation's despicable history of racism and our modern day racist policies and systems. I'm not saying that the conversation will remain centered on race, but in my 28 years in Washington doing this work, there has never been a time when an administration, members of Congress, advocacy groups, academics, and others were as focused not only about talking about race and racial disparities, but in thinking about how various policy options do or don't promote equity. Now, that isn't to say that everyone's committed, and I'm not saying that the center-right part of the political spectrum has embraced this conversation, But I do think it's important to say out loud when people are trying to broaden the conversation and trying to be more honest about how race and racism has resulted in disparities that require government action to counter. I'll just close with a little bit more of a personal reflection. I'm incredibly grateful to have had the opportunities to study at the University of Michigan, both as an undergrad and as a graduate student. And I'm incredibly grateful that I was able to study with my mentor, Sheldon Danziger, and then to work on policies that I care deeply about, both at the center and in government. There are so many ways to create change in this world: direct service, running organizations, business endeavors, advocacy, academic research, and teaching are just some of the ways to create that change. It is an enormous privilege and an enormous responsibility to have the opportunity to work, hopefully in partnership with others, including, importantly, with people who have lived experiences of poverty and racism in the low-paid labor market, to make change. It's just an enormous privilege and an enormous responsibility. For those of you in school or who have recently graduated or starting out in your career, I hope that over time you find ways to make change in whatever way suits your interests and strengths. And I know you got terrific training from the University of Michigan School of Social Work. And with that, I'll close this out and say thank you.
Thank you, Sharon. That was an incredible tour de force and so much rich and important work and important ground to cover. I'll just say to the audience, I've been a great fan of Sharon for many years, from her work both at the center and in the Obama administration. And she's one of those people who's just universally regarded as such a champion and such an incredibly thoughtful and effective player. I was just talking with Sheldon Danziger, who might have mentioned that he encouraged you to consider a PhD. So we were discussing whether or not it was good for the world that you went in a different direction. Clearly what you're doing matters a great deal. You also probably would have been a great academic too. So it was great for Sharon to see Sharon take over the Center on Budget and Policy Priorities. I can't overstate the importance of CBPP in the world of social welfare policy. And I'm going to focus on, I think, two ways that CBPP is so incredibly important. One is that pretty much any major policy change that you see come down, whether it's with the EITC or SNAP, they've played a role in, right? So they really focus on the big picture stuff. At the same time, they really focus on the little stuff, on the incremental stuff. And in my own work with the state of Michigan, I've come to realize how incredibly important all of that is. So I serve as a special counselor to the Department of Health and Human Services that administers a lot of these programs. And as we did things like reform our asset tests for food assistance and allow people to self-attest, as we thought about different waivers that we would ask the federal government to recertify people over longer durations, as we thought about mechanisms to meet our workforce participation rate in the TANF program, which is a whole set of acronyms that makes your eyes want to glaze over. My first call has always been to the center because they know all the Sharon's staff knows all of these details. And the amazing thing is we can think about these big picture transformational moments and these big picture changes and how much they matter. And they are more fun. But if you want to talk about fun, you got to talk about the chances that we have every day in state government and local government, as Laura's going to talk about, to make a major difference in the lives of people with one or two incremental changes at a time. I also reflected on how the role of states really matters a great deal. So Sharon mentioned one of the rollouts early in the pandemic was PEBT, food assistance for kids who are missing school. And that particular program ended up being fairly complicated, right? Where states had to create a plan. You usually had two bureaucracies that had to intersect between education and human services. They had to create a plan. They had to get it approved by the federal government. They had to merge data. They had to get cards to send people. And I was really proud that Michigan was the first state out of the gate on that. And a little bit of gas that it took other states months. And in some states, I know Texas in the second round hasn't even gotten the dollars to kids. And so trying to think about how do we even that out? Sharon talked a lot about unemployment insurance too, and where you see lots of states making decisions to cut that aid. And I think this is a great time for us to think about what should the role of the federal government be and what should the role of states be. The second thing I just wanted to draw out was this incredibly important point that Sharon makes about economic security or social welfare policy making during COVID. I would say what we've done during this time is an entirely different animal from anything that we've ever done before. It built on a lot of the knowledge and things that because we knew where the gaps in the safety net were, I think we were able to move things in the right direction. But when you just looked at the dollars, right, that she tallied up and the amount of aid that was submitted, you're talking about $4+ trillion in aid to families. And so that's just a scale that we've never seen before. And so the fundamental question right now is the one I think Sharon raised. The way I would phrase it is this an anomaly, right? Was this a time when we acted because of an economic crisis and a public health crisis like we've never had? Or is it the start, an imperfect, but a new start to a brighter future? And so that's the question we really have to ask ourselves right now is what are we going to do going forward? Are we going to learn from this pandemic? Or are we going to sort of revert back to the old debates that we had and the old sort of ways of doing things? I would say that this safety net response was different in the scale, right? As Sharon said, I think we all now think that what we did during the Great Recession was far too small, and we hurt ourselves in the long run, and we saw huge spikes in hardship during that time. It was different in the breadth, right? So when you think about the economic stimulus checks, they missed people, but they were broader in terms of having a big tent and being available to low-income families who had no earnings at all, right? We've never done something like that, up the income scale. And those have proven both to be effective. If you saw Sharon's chart on food insecurity, you can see when we send those stimulus checks out in December and then under ARPA, all of that food insecurity just shocks downward in like a striking way. Another piece of that is sort of the speed element, right? So we've gotten good at the stimulus checks. And so thinking it forward, right, how do we go from having these sort of mechanisms by which we had to sort of get up and running, right, and get the money out to being ready to go when a crisis hits so we can sort of head it off at the pass? Cash is a useful way to do that, right? So when we think about the different things we have, SNAP is actually really, as Sharon mentioned, one of the easiest things we can do is just shoot more money to people's cards. And so doing that simply, right, and saying, we're going to send you money through SNAP, and we're also going to send you flexible, fungible money, right, just makes it easier to administer. And that was the approach that we really took in this crisis that was so much different from anything that we've done before. And then finally, the CTC expansion is near and dear to my heart. And it's something that has the potential to eliminate the most extreme forms of child poverty. And we are at this sort of precipice, this very moment where we're going to see this is something that's been made law for 1 year, and we're going to see what happens. Are we going to extend it into the future, or is this going to be a one-time anomaly? So we are at this incredible moment where I think we've learned more about how the safety net can respond to hardship. And it certainly wasn't perfect by any stretch of the imagination, but we went further than we've ever gone before. I think we've learned the importance of how we think about collaboration across levels of government and across sectors. And the future is uncertain. And this is a moment where I think we as social workers and social work scholars can say, we want to go in a new and different direction and really even out the safety net in ways that we didn't even imagine were possible a few years ago. Laura?
Thanks, Luke, and thank you, Sharon. That was incredible, just seeing everything in one space and how it all came together. Your comments about how much infrastructure mattered to our crisis response just really resonated with me on a local level. So I was working in the Detroit homeless response system during the first year of the pandemic, and Just seeing that infrastructure does really matter, and I'll talk about kind of 4 different points and how they all came together, but definitely highlighted the issues created by historical silos within each system. So you think of the behavioral health system and the health system and the law enforcement, homelessness and workforce, and how historically we're not great at working together. And it was incredibly necessary to work together during the pandemic and creating a model for how we can work together in the future that we hope doesn't get lost. So if you're thinking about these silos and how they played out on the ground, you realize that a lack of basic knowledge of each other's systems and how to access services, what services are available, and just our resource capacity and limitations, that was huge in starting to work together and starting a conversation. And also it affected our view of seeing our shared clients or customers as a whole person, right? We only saw people through our own systemic lens. And I think that was really, all of those issues were exacerbated by how all of our roles just shifted and changed as a response to the pandemic. So a lot of us on the ground had to change our focus. Law enforcement changed coverage areas, working with new populations. The health department, everybody was doing a new role. So it really affected all of those knowledge gaps of each other's systems and how to help and work together. Kind of like that divide was deepened. I think one observation that was really, really basic is that one system cannot alone meet the needs of a whole person. And I know that sounds really obvious, but like, boy, did we see that in the pandemic every single day. While we know that, for example, connections to behavioral health, substance use treatment and mental health services really matters for the homeless population, it's just the infrastructure isn't there. And so creating those opportunities to how do we go past a referral and making sure that both systems are working and holding that person through the entire process. The homeless system is only an expert in housing and homeless services. They cannot provide the mental health or behavioral health services needed to stabilize that person. As an example, there's obviously a lot of other systems that homelessness intersects with. So those were 2 of the kind of big picture things that were highlighted during the pandemic, and again, really led to huge opportunities for cross-system collaboration. So a huge one obviously was between the homeless system and the Detroit Health Department in creating a response in congregate settings. So they were able to very quickly mobilize a very robust and effective response for those that were in emergency shelters. So apart from having a robust response that included, symptom checking and public health nurses coming to shelters, decongregating the space, reducing capacity, they were running from scratch 2 new COVID shelters, one for people that were symptomatic and needed to be tested, and one for quarantining for actual positive cases. So that was a huge collaboration, and I think it can be a model for how we collaborate in the future with other systems. It doesn't have to only be with the health department. It can be taken and replicated, right? Like, we learned so much from those collaborations and creating that infrastructure. And same with Sharon and Luke both mentioned, like, will that be lasting? Are we going to choose to build on that? And I hope it's true for Detroit. The other thing that really resonated with me was that both Luke and Sharon touched on this, was that incremental change matters. Like, I think locally, trying things out in more of a pilot phase makes communities go farther. So just an example of saying, hey, we want to end family homelessness. That is really daunting. Agencies might not want to participate because they don't want to fail. We don't know how to do that. What does that really mean? And so instead creating a pilot that says, let's reduce the number by this much. Let's connect this many families to this service, right? To this program. And just allows you to do it on a small scale, learn, and then scale up as needed. So I really appreciate that. And at a local level, we have that power to really take our time and test things out in short spurts in order to then scale up and apply what we learned. One of the other things that I want to remind everybody of, and that Sharon, you touched on this on creating change and what that can mean so many different things, but reminding everybody that advocacy matters, and it doesn't have to be a big splashy newsworthy advocacy effort. You know, your advocacy effort doesn't have to make the news in order for it to be effective. And so one of the things that I was charged with before the pandemic actually was creating policies to have a coordinated protocol for health and safety measures for unsheltered homelessness. So that included law enforcement, the homeless system, and the health department as those key entities coming together to have a coordinated response that didn't exist before in Detroit. And we wanted to be able to really focus on if people needed to be asked to move that were experiencing unsheltered homelessness, then we had to have a really good reason that was based on health and safety. However, the pandemic happened, those policies were not implemented, and we saw the repercussions of that coming out when people that were experiencing unsheltered homelessness were asked to move for their safety, right? But CDC guidelines stated that they actually should be sheltering in place unless housing was provided, which we did not have all of a sudden an abundance of housing all quickly available. So I think the lack of that infrastructure and foundational cross-systems collaboration and the lack of having to implement that coordinated response really meant that people on the ground, like the people actually that we're meant to serve, were being shuffled around in a way that wasn't in accordance with CDC guidance. So I think, like I said, those things that we saw with not having that basic foundational collaboration already and relationships and knowledge of each other's systems really hurt kind of advancement of those policies. However, I think what was really key was advocacy and having some of our local advocates that banded together from different agencies and enlisted the help of State Representative Rashida Tlaib, for example, and it was incredibly effective in moving the policies on a quicker timeline than I would have been able to with our partnership. So I just want to state that your advocacy, everybody's advocacy on the ground really matters to enact change.
Thank you, Laura. That was great. And I love that we have sort of these three levels of government and three levels of action and how they fit together and how important they are. We have an eye-popping 80 questions that have been submitted. It sounds like a very U of M School of Social Work thing to do. And many of them can actually be, I get to play the MC to this part. I'm going to send a lot of them to the two of you, Sharon and Laura. But since we have 15 more minutes, I'm going to ask you to give sort of short answers so we can get through as many as possible. But Sharon, I will give you just a minute. We can go right into questions, or if you had any reflections following discussant remarks.
So thanks. I won't take a lot of time. I will say I am so pleased that we have the state and local perspective here because, you know, in Washington, we can shovel money. We're pretty, you know, like if the political will exists, like we can get money out the door. And but at the end of the day, most things are implemented at the state and local level, and a tremendous number of policy decisions are also made. It's not like all the policy decisions are made and the money comes down and then you know exactly what to do. In fact, there's a tremendous amount of policy decisions, as well as like, how in the world are we going to make this work, that happens at both the state and local levels. And that's one of the things, as I reflect on my career, that has always been a real highlight for me is I actually spent 2 years in the DC Department of Human Services, where I could kind of do state and local at the same time because of the unique circumstances of the District of Columbia. And I say that because I have over many years, people, early career professionals have come and said, wow, what do you think about this? And I always say to them, you will learn so much if you go and do at the local level or at the state level and see how hard it is. You will have a whole new appreciation for why simplicity really sometimes is more important than being super target efficient or having every bell and whistle kind of laid out it perfectly, because if it's too complicated to implement, it won't reach the people you're trying to reach. And so for those of you thinking about kind of next steps or future steps, I do think that work at the state and local level, as well as, direct service, are all just such a big, important part of this ecosystem. So why don't I turn it back to you so we can get to folks' questions?
Okay, our starting question, actually, I'm going to direct to both of you as distinguished MSW degree holders. How did your social work degree contribute to your work directly post-graduation, the decisions you made and how you thought about your work, and how has it influenced your career choices thereafter? We'll start with Sharon and then go over to Laura.
Sure. So I just want to say that I think many things that happen in life are, partly about what you think about and partly a little bit by chance. So I wouldn't say that I left the School of Social Work at the ripe age of 23 and had it all mapped out and saw what it was going to be. I did think I was going to spend more time in direct service, but we were coming off the 92 election. I probably had more optimism than was warranted about what the change that election might bring. And so going to Washington seemed like a really important thing to do at the moment. I struggled between whether to go into government or to go to the Center on Budget and Policy Priorities, and ultimately decided to start the nonprofit route, and I would go to government later. I look back at that decision. I'm not sure how I made it. I will say that the founder of the center did call, it's kind of crazy. He's the founder of an extraordinary person. And I was 23 and he called and he spent 45 minutes on the phone. I was standing in my apartment. I was standing on my apartment on North State Street and trying to make dinner, as I recall. And he kept talking about the mission-driven work of the center. And that's where I ended up. And then sort of things flowed from there. But I think, for me, my degree was largely policy-based. It was pretty multidisciplinary. I took things both inside and outside the School of Social Work. And I think that work, including the work I did as a research associate or research assistant or whatever I was called for then Professor Danziger, now I think of him as Sheldon, all of that gave me a set of tools. And those tools could have been applied to many, many different things. And what I'm so grateful for is that the tools were there and that there are so many different ways to use them.
Laura?
Maybe Laura had her whole life planned out.
Not so much. I came into social work after I had come to U of M and I did a English and Fine Arts degree, and clearly not social work related at all. And I was actually working as an undergrad in a nonprofit and coordinating programs for kids, and I fell in love with it and realized that I really wanted to work with people. As you know, U of M doesn't have a BSW program, or didn't at the time, and I really didn't have that option. So it really filled kind of that gap that I was looking for. But I actually did my my track. It was clinical track. I did interpersonal practice and really did not know I was interested in policy or evaluation until literally my last semester. And so it was during my evaluation class that I also fell in love with it, and ended up, instead of going on a clinical journey, ended up managing a few different federal grant programs before landing in the homelessness system in a policy position. So I definitely did not mean to end up here, but I'm so glad I did. And a lot of what I tell people is that your skills are so transferable. And even if I spent all of my education in a clinical internship in clinical field, and I still was able to kind of pick things up. We're all capable of learning on the job, and I'm so glad that I kind of went in a different direction, because it really highlights a lot of the qualities that I bring to the table in terms of being super project managing, and I'm very good about timelines, and I'm good at writing, and you know, all of that culminates in the policy and evaluation work that I do. So the journey was very undefined.
It's great to hear those stories. I'm going to combine just a couple questions. One from David Bullock in the chat, who asks, some suggest that racial disparities can ultimately be addressed by class-based interventions or income-based interventions. Is that a viable way to think about public policy solutions moving forward? And what about reparations and reconciliation with Native nations? So we're obviously not going to cover all of that, but if there are thoughts or sort of where you're headed with those questions, that'd be great.
Sure, I can start. I'm a both and person. And what I mean by that is things that are targeted by income often have racially disparate impacts, right? On both sides of the ledger, right? When we do big tax breaks for high income people, they overwhelmingly benefit white people. And when we have when we provide a kind of benefit or support that's targeted on lower income people, the benefits are disproportionately people of color, though I will say less lopsided than high income tax breaks. And so one important thing is it's really important to study it. It's really important to analyze the racial impacts, right? If it might be that your policy lever is going to be income-based, but if we don't analyze the racially disparate impacts of our policies, then we are shooting in the dark about whether our policy proposals are going to make them worse or going to make them better. So that's an important thing. So on the child tax credit, as an example, there's several different expansions that are going on at the same time. One is to increase the amount of the child tax credit, and the other is to say we're no longer going to give less help to poor and low income people than we do to middle and upper income, but not the wealthiest kids, right? We're not going to do that anymore. And poor and low income kids are going to get the same amount as middle and higher income kids do, okay? That's one policy. And the second policy is that we're going to increase the actual amount of the credit. Both of those have anti-poverty impacts, and both of them are important. And we did both of them in the rescue plan, and our goal is to get both of them across the finish line. But if you could only do one of those, if you could make the full credit available to poor and low income kids, or you could increase the credit from $2,000 to $3,000 per kid, it is not a close call which one you should do. You should make it fully available to poor and low income kids, because if you don't do that, then all the poor and low income kids get no help at all because you increase the amount of the credit, because they don't get the full credit anyway, and a bunch of them don't get the credit at all. And if you're trying to close racial gaps, right, you're trying to address very large gaps, disparities in child poverty between kids of color and white kids, the impact on racial disparities is much larger if you make the full credit available to poor and low income kids than if the only thing that you do is increase the credit. And so part of this is we have huge racial disparities. They didn't come about by accident. And if we're going to address them, we have to address them in a race-forward, race-conscious way. That may mean policies that are income targeted. Maybe that's the policy lever that you pull, but it is absolutely critical that we're conscious of it, that we're measuring it, that we're analyzing it, we're looking at different policy options, and we're seeing what the racial impacts are. The other thing to know is that on average, poor kids of color and poor white children don't have the same circumstances. So poor kids of color are more likely to live in poor neighborhoods. They're more likely to go to less resourced schools than poor white kids. That does not mean that being a poor white kid in America is that you have broad opportunity available to you. But it is to say that on average, there are disparities, even if we're only looking at poor kids. And so that means that we have to be conscious of those disparities, even when we're only looking at things that will help the lowest income kids. And we have to, or lowest income families. So the policy levers that we pull, look, like for really good reasons, lots of race specific policies aren't legal, except for the legacy ones that created the racist system we have. And so our policy levers have to be both legal and workable. But if we don't measure and aren't serious about the goal we have, which is both poverty reduction and reduction in economic disparities, but also addressing persistent race disparities by race and class, by race and ethnicity, then we have to look at it through that lens too.
Great. Laura, I want to try to get in two more questions. I'm going to ask one more to Sharon, and then I'm going to ask one for you. And we got about 2 more minutes. Of course, on the CTC, I totally agree. Fully refundable is the most important thing. Although I do want the increase to be included too. And monthly. We're
going to get them both. That's the goal.
All right, that's what I love to hear. Dinner on me. And the monthly structure, of course, evens out the refundable tax credit issue that you so eloquently mentioned. Sharon, of course, whenever we start talking about expanding social welfare policy, people say, well, where's the money going to come from? And often we don't seem to have that question when we're talking about spending money in other ways, but set that aside. Where is the money going to come from? Can you think about, are there places where we should be raising revenue that don't hurt the economy, that are the appropriate ways to go about this?
Yeah, thanks for that. So just very briefly, we have lots and lots of things on our website about revenues. So anyone who's interested, I always welcome everybody to join the tax fight. So let me just say a couple of things. First is the United States remains a very low tax country. And that has resulted in a very low service country that does far less to help struggling households and kids and families than other countries, okay? And the fact is that our near kind of worship at the idol of tax cuts has actually shrunk our ambition about what we can achieve if we're willing to make public investment. So I make no apologies for being really clear that in order to get to an equitable and just society where we do more to help kids, where we have better opportunity, much more broadly shared, we have to have a more equitable, a more sustainable, and a more adequate revenue system. We have to raise revenues in this country to pay for things that are important. And when you think about high-income people and profitable corporations, they have benefited to a very large degree by the public investments that we have made, right? They are successful because we invest in education. They are successful because we invest in infrastructure. They are successful because we invest in basic research. And so asking profitable corporations and high-income households to pay a more adequate amount of revenues so that we can both grow the overall economy, but most importantly, so that we can broaden opportunity and have a prosperity that's more shared, is the right way to go down this path. One of the things that is most heartening about the agenda that the Biden administration has put forward is that they have called this out. They have said, we can have things. We can have childcare. We can have a child tax credit that helps everybody. We can have a paid family and medical leave program. But the way to do that, the only way to do that is to be serious about raising more revenues. And by doing that, they have made clear what the trade-off is. So this year is a year where we're fighting every day on things like expanding the child tax credit and closing that Medicaid coverage gap that I talked about. But we are also fighting for a more sustainable and equitable and adequate revenue system. So there's lots of stuff on our website about corporate taxes and international reform and how we can raise more revenues from high-income households. And believe me when I say they will be fine. They will still have very good quality of life. They will still have big houses. Their opportunity will not shrink. But that is the pathway to getting these other kinds of investments in the country.
Great, thank you. Laura, you get the last word. I'm going to ask you, as you're looking in your work in the city of Detroit, of course, with AR key. There's a lot of money coming to municipalities. What is one thing that you would like to see us do and sort of be in a very different place, say a year from now or 2 years from now, as a result of the investment or the lessons that we've learned? If you could leave us with sort of one or two things.
Okay, so in Detroit, I think that one thing that has been really great in response to all the money that has flowed into Detroit, and at least on behalf of the homeless system, has been a focus on equity. And so working to figure out how to infuse equity into everything that's done. So when the money comes to the city, how are RFPs being issued, right? What are the questions that are being asked for applicants? How are we scoring for racial equity? How is the money being awarded? How are we making sure, as Sharon was saying, looking at the data to see, like, are these outcomes shrinking the disparities that we're seeing on the ground? And so I think my hope is that continues and is scaled way up. This is just the beginning. The funding is obviously short term, but I'm hoping that the lasting change that is kind of left from this is that we are infusing equities and shrinking those inequities. Sharon mentioned that there's inequities created all kinds of ways, and one of those can be even with our assessment and triage tools that we're using. Like, you can see that the racial disparities are heightened with it, actually, as one example. So I think we're focusing on using data and reviewing what are our outcomes and what does this mean for, across the different populations that we're serving, across race, across gender, things like that. So I know that that's very removed from very specific policies, but I think it's so important that we're moving in that direction, and that it's just continuing to be integrated into every part of the system. And who we're funding.
You're talking about building racial equity sort of analysis into every piece of the fabric of our programs and the way we help people. It's a great way to end, to think about both the small, medium, and large ways that could improve the services we provide. Thank you both. This was a treat for me. I'm going to send it over to Dean Videcka for a final word.
Sharon, Luke, and Laura, thank you so much for the rich substance and for helping us keep a laser focus on racial equity during today's talk and discussion. It was truly engaging and educational conversation. I want to thank our Centennial Planning Committee who planned this event, our development team, and special thanks to my Planning Committee co-chair, John Trotman, and to Emma Krasaniak for all the work in making this event a reality. Thank you to all of our Michigan Social Work alumni and friends for attending and participating. Please continue to check our Centennial website for more upcoming events and other ways to participate in the Centennial celebration, including telling your story as a part of the Michigan Social Work Oral History Project. Have a wonderful evening and go blue. Thank you.